Welcome to today's episode on mental health and substance abuse, the connection in our communities. I am Shalmi, a clinical psychologist. Let's discuss the effect of mental health on the individuals and families in our communities. Mental health and substance use are deeply connected, and understanding this link is vital to breaking cycles of addiction and stigma. Today, we'll explore how these issues interact, the importance of early intervention, and how culturally relevant integrated treatments can help our communities to heal. The most important thing that we'll discuss today is exploring the bidirectional link between mental health and the substance use disorder or substance use. Now, understanding the connection is very important. In our communities, mental health issues and substance use are often intertwined. Many individuals face stressors like discrimination, financial hardships, or cultural pressures which increase the vulnerability to both mental health challenges and substance misuse. The connection is bidirectional, which means that mental health challenges like anxiety, depression, or trauma can lead to substance use as a coping mechanism. And substance use often worsens or triggers the mental health conditions. I would really like to share the prevalence of this coexisting or co-occurring mental health and substance use disorder statistics. This is called the dual diagnosis, where individuals experience both mental health issues and substance misuse that occurs in approximately 20% to 37% of the people across all UK mental health settings. This was the report by NHS Digital. Now, 70% of drug users and 86% of alcohol users in community substance misuse services experience mental health problems along with it. In England, about 3.1% of the adults show signs of drug dependencies, with men being 4.3% being more likely to be dependent on illegal drugs than women, who are 1.9%. Now, the suicidal ideation is up to 6 times higher in individuals who are struggling with substance use disorders, particularly among those who used opiates, cocaine, and alcohol exclusively or excessively. However, if we talk about Scotland, in Scotland about 64% of the individuals who died from drug-related causes in 2022 had a history of mental health issues, and that was the report of Scottish government drug deaths. Now, let us talk some real-world applications as well. The London Dual Diagnosis Network has integrated mental health and substance misuse treatments, improving the recovery rates by 40% in community-based programs. Whereas if we talk about Manchester, in Manchester, co-located mental health and addiction services have reduced emergency psychiatric admissions by 25%. A Glasgow-based intervention program that combined trauma-informed therapy with substance treatment saw a 30% decrease in relapse rates, which is immense achievement. Now, the question is how mental health challenges lead to substance use. People often experiencing depression and anxiety may turn to substances like alcohol or cannabis for temporary relief, which is then in result increasing the risk of dependency. The individuals with post-traumatic stress disorder, including the survivors of abuse or conflicts, are twice as likely to develop the substance use disorders. That is again the report of UK Trauma and Addiction. Now, young people who are of the age group 16 to 24 years with severe anxiety are 50% more likely to experiment with drugs and alcohol than their peers without mental health conditions. People with bipolar disorder, they are up to 4 times more likely to develop alcohol dependence And again, this was into the report that was given by UK Royal College of Psychiatrists. There are more statistics to it. 29% of adults in England with a severe mental illness or mental health issue have a substance use disorder as well. NH has clearly declared this. 1/3 of individuals diagnosed with schizophrenia misuse the substances at some point into their life that actually exacerbate their symptoms as well. Alcohol misuse. Now, alcohol misuse actually contributes to 40% of all the hospital psychiatric admissions, and this was the actually case study in Wales by Public Health Wales. There are some other real-world applications and examples as well. Let's take an example of Leeds. Leeds actually introduced mental health and substance use co-treatment clinics, that reducing the crisis episodes by 35% in high-risk patients. A Nottingham-based program providing cognitive behavioral therapy (CBT) alongside with addiction treatment led to a 50% improvement in long-term recovery rates, which is again more appreciating. Now, how substance use worsens the mental health conditions? That's a very important question. Now, chronic substance use alters the brain chemistry, worsening the symptoms of depression, anxiety, along with psychosis. The long-term effect or the long-term alcohol misuse increases the risk of severe depression by 60%, often leading to the self-harm or suicidal thoughts. That is again a report by Alcohol Change UK. Let's talk about cocaine. Cocaine use have been linked to a 40% higher likelihood of developing panic disorder and along with that anxiety disorder. Individuals who are actually misusing the substances are twice as likely to be prescribed antipsychotic medication, which is actually indicating the severity level of their mental health and the distress. This was the NHS prescribing data that was given back in 2023. Now, 48% of the young people in the UK with substance dependence have also been diagnosed with anxiety disorder. Among the people with opioid use disorder, 70% also have diagnosed mental health condition. That was the report by UK National Treatment Outcome Study. Now, regular use of cannabis or the regular users of cannabis are 4 times more likely to experience psychotic symptoms, particularly in vulnerable individuals. A report by King's College London Psychosis Study has identified these statistics as well. The Bristol Early Intervention Services, that is again a service for the people with addiction, has successfully reduced psychotic episodes in cannabis users by 30% through early screenings and integrated care, a great achievement indeed. In Sheffield, combined mental health and substance use recovery groups have shown a 45% improvement in treatment adherence. Addressing in the bidirectional link. Now, the bidirectional link can be seen based on the solutions. So, a dual diagnosis treatment can be introduced. The UK has expanded dual diagnosis services to provide a holistic care for the individuals with both mental health and addiction challenges. Now, the NHS long-term plan aims to increase the funding for this integrated mental health and addiction treatment by £500 million over the 5 years time period, which is a huge amount. Now, over 50% of the UK addiction services now offer co-located mental health support, improving the patient's outcome. Now, early intervention can be of a great source for improvement. Mental health education in UK schools has led to a 20% decrease in substance misuse among the teens. Scotland's public health initiative to train the general physicians in recognizing the early signs of addiction and mental health disorders, that has improved early intervention rates by up to 30%, which is a great achievement indeed. Let's just have a look onto the community-based approaches. London's Mind, the GAP program, has integrated mental health and addiction services at a community level, reducing the emergency hospital admissions by up to 22%. Northern Ireland's Recovery Together initiative that actually connects individuals with lived examples or success stories of the mental health and substance use issues to peer support networks, increasing the long-term recovery rates by up to 40%. So now here we come to a conclusion that the relationship between mental health and substance use is completely complex and deeply interconnected. In the UK, evidence shows that individuals facing mental health struggles are at higher risk of substance dependence, while substance use can further deteriorate mental well-being. So, addressing both issues simultaneously through the dual diagnosis treatment along with the early intervention and community-based support can actually improve the outcomes and reduce the burden on the public health systems. So, by this integrating mental health and addiction services, the UK is actually making strides in breaking this cycle and fostering the long-term recovery as well. We also need to understand this phenomena on the basis of community-specific context. So now, substance use and mental health in the UK on the basis of the community context can be understood by the challenges that vary across the regions, demographics and socio-economic factors in the UK. Now, understanding these differences actually helps in developing the targeted interventions and reducing the harm at the community level. Now, there are certain regional variations in substance use and mental health. So, let's just have a look to it. As far as Scotland and the northeast of England have the highest drug-related death rates in the UK. In 2023, Scotland recorded 1,051 drug-related deaths, the second highest on record. This was given by the National Records of Scotland. Now, in northeast England, drug misuse death rates are 104.1 per million people, the highest in England and significantly above the national average of 53.3 per million. Now, economic deprivation, unemployment and lack of mental health services actually contributes to the higher substance dependence in these areas. Where in contrast, if we talk about urban centers like London and Manchester, they report rising cases of alcohol dependency along with mental health crisis among young professionals. And that often links to high stress, job insecurity and social pressures as well. Now, as far as London is concerned, in London, 27% of the professional within the age bracket of 25 to 39 years reported engaging in hazardous drinking, a rate higher than any other city in UK. Community impact on the families and youth, children in household affected by substance misuse as well. Let's discuss the statistics about that as well. An estimated 1 in 10 children in the UK, which is 2.6 million, live with a parent struggling with alcohol dependency. This is the Children's Commissioner for England report. 30% of child protection cases in England actually involve the parental substance misuse. Now, children from homes affected by substance misuse are twice as likely to develop the mental health disorders later in life. However, young people in economically disadvantaged areas are also being deprived. They are also struggling. In these deprived areas, young people are twice as likely to misuse the substances, often due to the limited access to the mental health services and lack of youth engagement programs as well. This is very alarming. And in the most deprived areas of England, Specifically, the hospital admissions for drug-related disorders among the young people, which are of the age bracket 15 years to 24 years, have actually increased by 18% in the last 5 years. Youth in the rural areas also face a lack of accessible support services, which is then increasing the risk of self-medication with alcohol or any other drug. Now, you might have understood these things, but peer influence and social factors are also involved into it. Now, teenagers in areas where there is a high rate of substance use are 3 times more likely to experiment with drugs and alcohol. However, 50% of the young people in the UK who use the substance say that peer pressure influenced their initial use, and this was again by the Public Health England report. Now, after school and community youth programs have been shown to reduce teenage substance use by 20%. Yet, funding cuts have left many areas without these protective initiatives in UK. We need to understand the stigma and barriers to seeking help in this condition. Fear of judgment and societal stigma is one of the most important factors. Statistics says that 41% of the people with substance use issues in the UK say that stigma prevents them from seeking help. However, in the faith-based and culturally conservative communities, discussing addiction remains a taboo and discouraging individuals from accessing the support as well. Now, men in the UK are less likely than women to seek treatment for substance misuse, partly due to the societal expectations of self-reliance. This was again the UK Addiction Treatment Report. Among all of these things, we need to understand the ethnic minority communities and cultural barriers as well. Studies have shown that only 6% of the people accessing the drug and alcohol treatment in the UK are from Black, Asian, and other ethnic minority backgrounds, despite evidence that these groups face unique challenges with addiction. And this statistics has been reported in UK Drug Treatment Report. Among South Asian communities, the cultural stigma around mental health leads to higher rates of unreported substance use, particularly with alcohol, nicotine, and any other prescription drug dependency. However, Black and ethnic minority individuals are twice as likely to be detained under the Mental Health Act. Often they are linked to untreated mental health and substance misuse issues. This was the report given by the UK Racial Disparities in Health. We somehow need to understand the LGBTQ community and the barriers of care they are facing. Now, 1 in every 3 LGBTQ individuals in the UK report using substances to cope with discrimination, with anxiety, or any of the social rejection. Now, the trans individuals are at highest risk, with 40% reporting substance misuse struggles linked to mental health stressors. Now, lack of the culturally competent treatment programs means like LGBTQ individuals are less likely to seek the formal addiction support because of the discrimination level. Now, in ethnic communities or in ethnic minority communities, I would say, stigma around mental health can lead to silence, which makes people turn to substances like alcohol, nicotine, or any other prescription drugs to cope. Now, the lack of culturally sensitive mental health services exacerbates this problem to a massive level. However, we need to understand the role of community-based solutions. Among these could be the local charities and peer support networks. Now, the community-led initiatives actually play a very vital role in bridging the gap between where the government services are lacking. And UK charities like ADFEM provides family support for those affected by addiction. It also helps them to overcome, it helps them or helps 10,000 families annually to overcome through various workshops and mental health programs. If you talk about Alcoholics Anonymous and Narcotics Anonymous, in UK they have over 4,000 active support groups that are helping the individuals to achieve the long run or long term recovery. Whereas the faith-based addiction support programs in United Kingdom or specifically in Birmingham and Leeds have seen a 50% success rate in helping the individuals to maintain sobriety through community engagement. There have been lots of grassroots recovery programs and mental health first aids. Let us have a look on few of them. Now, community-led rehab centers are gaining the traction in the UK, particularly in the rural areas where traditional services are actually unavailable to the people. Now, mental health first aid, MHFA, this is the training and it is now available in over 70% of the UK workplaces that are actually helping the employees and the managers to recognize and actually respond to the substance use issues before they escalate. The youth mentoring programs, they have reduced the first time drug use in at-risk teenagers by 30%, showing that the power of community intervention is massive. There have been several digital initiatives that are actually expanding to provide the access to care. Those can be teletherapy services. These teletherapy services in the UK have increased access to addiction treatment, particularly in underserved areas, and they are reducing the travel barriers for the rural residents as well. Now, there are certain online peer support groups like Smart Recovery UK that has seen almost 150% increase in participants post-pandemic, proving that the digital solutions are bridging the treatment gaps. The most important is NHS. The NHS is actually the piloting program, that is AI-driven mental health support chatbots, which have successfully reduced anxiety and substance use cravings in early trials. And this could be found in the NHS Digital Innovation Report. Let's move towards an inclusive community-driven approach. Now, strengthening the partnership between the healthcare providers, the social services and the community leaders can improve the outreach along with the engagement into this particular phenomena and program. We need to encourage the open conversations in schools, the workplaces and religious institutions to help reduce the stigma and promote early intervention. Investing in preventative programs actually, such as youth mentorship or stress management workshops, can reduce reliance on the substances as a coping mechanism. But the question that comes here is that how untreated mental health issues can actually escalate the substance abuse in the UK. The mental health and substance misuse are deeply interconnected, with untreated psychological disorders often leading to or worsening the substance abuse. Now, in the UK, this issue is particularly concerning due to the gaps in the mental health services, the social stigma that prevails, and along with that, the economic hardships that drive the individuals towards self-medication. Now, we literally need to understand the self-medication and the cycle that works behind this self-medication. Many people with anxiety, depression, post-traumatic stress disorder and bipolar disorder turn to alcohol or any other drugs to relieve their emotional distress. NHS reports indicate that 57% of the adults in UK drug treatment programs have coexisting mental health issues. As far as alcohol and cannabis are concerned, they are the most commonly used substances for self-medication, often worsening the symptoms over the time. Statistics have shown that 44% of the people with post-traumatic stress disorder in the UK report using alcohol or drugs as a way to cope with trauma. but we can also understand the individuals with severe depression who are twice as likely to develop an alcohol dependency. According to a study by the UK Addiction Treatment Centre, this statistics is very considerable and important. Now, young people aged within the age group of 16 to 24 who suffer from anxiety or depression are 3 times more likely to misuse the substances. That could either be alcohol or any other. Now, we need to understand the impact of the mental health service gaps, and we can say the lack of accessible and timely mental health support in the UK has worsened the connections between the mental health struggles and substance misuse. Researchers have shown that in England, nearly 1.8 million people are on the waiting lists of NHS mental health services, leading many to seek temporary relief through alcohol or any other drug. We need to understand the young people and the low income individuals who are actually the most ones that are struggling, as public services are often overwhelmed and private therapies cost to an average person about 50 to £100 per session, like making it unaffordable for many people. Now, the average wait time for a first mental health consultation through the NHS is actually 12 weeks, but in some areas like the Greater Manchester and London, the wait times can be over years. So you can understand the condition of the strugglers. Now, over 75% of the people with mental health disorders in the UK, they have received no treatment, thus increasing their risk of developing substance dependency as a coping mechanism. Only 9% of the people with co-occurring mental health and addiction issues are actually receiving the integrated treatment, which is highlighting a major gap in the care. We need to understand the escalation into addiction and dependence. We need to understand how it occurs and what is the mechanism behind it. Now, when mental health conditions remain untreated, prolonged substance use can lead to severe addiction and dependency. Now, prolonged alcohol or any drug use actually rewires the brain, making users more susceptible to dependency and harder to the treatment. The United Kingdom saw a 26% rise in alcohol-related deaths in 2021, with many cases linked to untreated depression and anxiety. In Scotland, where mental health services are particularly under-resourced, the alcohol-specific death rates, they have reached about 22.9 per 100,000 people in 2022. The highest in the UK so far, and this was the record by National Records of Scotland. Now, opioid and prescription drug misuse is rising, particularly among individuals with chronic mental health conditions who receive long-term medication. Whereas UK opioid-related deaths, they have increased by 47% since 2010, which is a huge increase, with many linked to people with pre-existing mental health condition. Therefore, we need to understand that the use of benzodiazepine, which is an anti-anxiety medication, has surged by 60% in the last 5 years, and this is often leading to dependence among the people with anxiety disorder. However, if cocaine is concerned, now cocaine use among the people with mental health disorders has increased by 34% in the past 5 years. Particularly in the urban areas like London, Manchester and Birmingham. And this was the report by UK Drug Misuse Report. We also need to understand the societal and economic consequences. The burden of untreated mental health and substance use disorders actually extends beyond individuals, impacting the families, their workplaces, and above all, the communities. People often struggling with mental health issues or substance use are more likely to face homelessness, unemployment, and the criminal injustice involvement. Now, over the 45% of the homeless people in the UK have a dual diagnosis of mental health with a co-occurring state of substance use disorder. And that was the report by UK Homelessness Report. Now, in England and Wales, 65% of the prisoners have a substance use disorder and 50% of them have a diagnosed mental illness. Yet, only 16% have received the proper due treatment while incarcerated. The UK economy loses an estimated of £27 billion annually due to productivity loss, linked to the substance misuse and mental health issues in different organizations. Now, employers have actually reported the reduced productivity and higher absentees among the staff with untreated mental health concerns, and along with that, for sure, alcohol dependency. Now, the alcohol-related workplace absence cost UK employers an estimated £7.3 billion per year, and that was the report by Centre for Workplace Wellbeing. We need to understand that communities with high deprivation levels as well, particularly in Scotland, the North East and the inner city London, bear the highest burden of mental health and substance misuse. Now, in the deprived or the unprivileged or underserved areas, the substance use related hospital admissions are 3.5 times higher than in the wealthier areas. We need to break the cycle. We need to understand the need for the integrated treatment. Addressing mental health and substance misuse together is critical for recovery. Several researchers have shown that integrated treatment programs significantly improve the recovery rates. If we talk about the dual diagnosis treatment programs, that actually combine the mental health support with addiction recovery, and they have been shown to reduce the relapse rates by 40%. And that was again by the NHS substance use report. Now, in the UK, individuals receiving integrated treatment for addiction and mental health issues are twice as likely to maintain the long-term recovery compared to those who are receiving the separate treatments. So here we can understand the importance of the integrated treatment plans. Whereas cognitive behavioral therapy, the CBT, combined with medication assisted treatment, which is MAT, has a 65% success rate in helping individuals recover from opioid dependence. We need to understand that peer support and group therapy actually reduces the substance use relapse rates by up to 35%, thus highlighting the importance of community-based interventions. We also need to understand the government initiatives. Government initiatives to improve the mental health funding are increasing, with a £2.3 billion investment in NHS mental health services by 2024. But the experts actually argue this is still insufficient to meet the demand. Destigmatizing the mental health care and improving the access to affordable treatment can actually prevent the individuals from turning to drugs or alcohol as a coping mechanism. The important thing that we need to understand here is the encouraging early mental health treatment to prevent addiction and addressing mental health concerns before they escalate into substance misuse is crucial in the UK, where the growing mental health challenges, they are actually contributing to addiction rates. We need to understand that the early intervention, accessible treatment and social awareness can significantly reduce the risk of individuals turning to substances as a coping mechanism. For that, we need to recognize the importance of early intervention. As far as the importance of early intervention is concerned, several studies have shown that 75% of the mental health conditions begin before the age of 24 years. Yet, many individuals do not speak or seek the treatment until years. Now, this delayed mental health treatment actually increases the likelihood of self-medicating with alcohol or prescription drugs or any other kind of illicit substance. Now, we need to understand the common early warning signs that include anxiety, mood swings, or social withdrawal, and difficulty in managing the stress. Issues that, if left unaddressed or untreated, can lead to substance use. There are some barriers to seeking mental health support in the UK. The first one among them is the long NHS waiting lists. Now, over 1.8 million people in England are currently waiting for mental health treatment, leading many to seek relief through alcohol or drugs. Now, there are some stigma and cultural beliefs related to it as well. Many individuals, especially in marginalized communities, fear the judgment for seeking help, thus increasing the risk of silent struggles and substance misuse. However, lack of mental health education is also one aspect. Now, many people are unaware of early intervention strategies and the available resources, thus they delay their treatment. We need to also understand the role of schools, workplaces, and the community initiatives. Now, as far as the schools and universities are concerned, they should implement the mental health screening programs and provide early counseling support to the students. But on the other hand, the workplaces mental health programs can help employees to manage stress, preventing alcohol or drug use as a coping mechanism. We also need to cater the faith-based and community outreach programs as well, as they can encourage the individuals to seek support without stigma and thus promoting their mental health or mental well-being and over the self-medication. Now, expanding the access to mental health services is also very important. Increasing funding for local counseling services and crisis intervention teams can provide faster support for those at risk. Promoting the teletherapy and digital mental health platforms can actually bridge the gap for individuals who struggle to access the in-person care. Encouraging the primary care doctors to integrate mental health screenings into routine checkups can actually help to identify the concerns before they lead to substance use. And in order to do that, we need to create a culture of openness and support. And for that, we need to encourage conversations around the mental health in families, in schools, and even though in the workplaces. That can actually reduce the stigma and normalize the seeking help behavior. We also need to understand the community-led campaigns, that they should emphasize that early mental health treatment is actually a sign of strength, not weakness. And the government policies should actually prioritize early intervention programs to reduce the future addiction rates and alleviate the pressure on the healthcare system. Now, just for your knowledge, I really would like to share the tools and resources that are available there. Now, there are local helplines, there are online therapy platforms, and workshops specifically designed for the ethnic minority communities. We need to highlight these accessible and culturally tailored resources as well. I would really like to also highlight the success stories of the recovery through integrated treatment. Now, integrated treatment actually is the treatment where mental health and substance use issues are treated together in one of the most effective approaches. And this is going to be the effective approach for recovery for all the sufferers as well. We need to understand what are the community recoveries and how these stories can interlink to each other. We need to share real and anonymized success stories of individuals who sought help for both mental health and substance use. Emphasizing on how early interventions or community support and culturally tailored care can lead to recovery. We need the engagement for the audience as well. Now, recovery is possible for anyone. Our communities are actually resilient, and with the right support, we can overcome these challenges together. Now, at the end, I really would like you all to thank you all for joining us for this important discussion onto the beautiful topic about the mental health and substance abuse in our communities. Today, in this episode, we actually have explored the deep connection between these issues, the importance of addressing the mental health on the early basis, and the power of culturally relevant or integrated treatments. Remember, it's okay to ask for help. By supporting one another, we can create stronger, healthier communities. So if you or someone you know is struggling, reach out to the Awakening Rehab. And together, we can provide the care and the support that you and your loved ones need. Thank you so very much and have a great day.